Hi, everyone. Thanks for joining us today. My name is Amanda Whitman, and I'm a second-year veterinary student, class of 2023, here at Mississippi State University College of Veterinary Medicine. I'm from Logan, West Virginia, and I came to vet school wanting to pursue small animal medicine, including shelter medicine. I have a background heavy in cat shelter medicine, and I knew that Mississippi State had a pretty impressive shelter medicine program. So we're going to highlight that program today in this video by speaking with Dr. Kimberly Woodruff. Dr. Woodruff is an assistant clinical professor here at Mississippi State College of Veterinary Medicine. Her areas of expertise include shelter medicine, epidemiology, and preventative medicine. Good afternoon, Dr. Woodruff.
Hi.
Would you mind telling our watchers a little bit about yourself and what you do here at the vet school?
Sure. So, like she said, my name is Dr. Kimberly Woodruff. I am originally from Memphis, Tennessee, and I actually went to Mississippi State for my undergrad and my vet school, and then graduated in 2008. Throughout my time in vet school, I developed an interest in the shelter program at Mississippi State, and so I stayed on for a one-year internship and a 3-year residency in shelter medicine, and then joined the faculty in 2012 following my residency. So I've been around for quite a while and enjoyed every bit of it and enjoyed the students.
Well, I know we enjoy having you here at State. But for those who are watching that are a little less familiar with the idea of shelter medicine, how would you describe that branch of veterinary medicine?
Well, I think a lot of people are familiar with animal shelters that take care of homeless pets until they can be adopted. And so what many people may not realize is that there's a lot that goes into keeping those animals healthy. Those animals have a little bit of a different situation than the pets that we see just in the vet clinics every day. Those animals may have backgrounds that we're not sure about. They may have poor nutritional backgrounds. They're really stressed out because they're in a shelter. And so there's a lot of things that we don't deal with in veterinary medicine on a daily basis that we have to think about in shelter medicine to keep those pets healthy. And the other thing is, it's a little bit different, is that it's for all practical purposes, it's a herd of animals, right? And so we have to think about not just the one dog or the one kitten that is in front of us, but what happens in the shelter as a system, and how do we keep the shelter as a system healthy so that we can keep all of those animals healthy. That's it in a nutshell.
Well, I mean, that's an important branch to understand, I think, in veterinary medicine. Now, can you give us a little history on the shelter med program here at State?
I can, yeah. So the when I started, when I was in vet school, the shelter program was a lot different. It was based heavily on spay and neuter, and it's still based heavily on spay and neuter. But then that was the main arm of the program. And we would travel to shelters in a mobile unit that we got in 2007 and do a lot of spay and neuters for those shelters. And at the time, there was only one doctor, Dr. Bushby, that was leading that program, and he was the sole surgeon and the sole faculty member in that program. And it was occurring to him that he might at some point want to be able to retire. And so I did an internship and a residency with the idea that I would work on the program with him, and when he was ready to retire, I would assume responsibility for the program. He has since retired, although not very successfully because he still works with us part-time, but we're very lucky for that. So he's still around. But the program has grown quite a bit since the days of just strictly spay and neuter. We still have the mobile unit program. In fact, now, because of some combined efforts of our students a few years ago, we have 2 mobile units. We also have a stationary clinic on campus that shelters can bring animals here to be spayed and neutered by our students. And we have several programs that put students into shelters to take care of the health of those animals, to do physical exams and basic diagnostic tests and treatment plans. We have a branch of the program that focuses a lot on disease outbreak investigations. So we see that a lot in shelter medicine because these animals are so stressed out and there's animals coming and going all the time. It's a situation where we see a lot of disease. And so we have a branch of the program that tries to deal with that, mitigate that, and then perform some consultations so that hopefully we can decrease the incidence of disease in those shelters. So we have a lot going on here. these days. It's a pretty broad shelter medicine program.
Well, I know, speaking for myself and a bunch of people in my class, my fellow classmates, we are so excited for this rotation. That's like the highlight of like what we're looking forward to right now is to get to the shelter med rotation. But what kind of community impact would you say that this program has?
Well, I think the most obvious is that there's shelters in most communities. And in the communities that we work in, a lot of these shelters don't have veterinary support outside of us, or if they do, it's minimal. And so we're maybe giving them something that they wouldn't get otherwise. But hopefully, we're also equipping those shelters to be able to reach the potential adopters that would come in. We're making their animals more adoptable, and so hopefully, we are putting healthy, spayed and neutered pets out into the community, and we're equipping our students to know how to deal with those animals and how to help those animals and their adopters when they are veterinarians.
Yeah, that's something really important, and I think that's something a little extra that we get with this program.
Right.
So, what kind of impact does this have on the students? What do we get from this? One thing I think is really important about the program is that we as vet students will graduate with an awareness. We're going to be hyper aware and appreciate the overpopulation problem that we face here in America and, well, really the world.
Right.
It's a pretty heavy problem, and I think we leave here with a good appreciation for it. But besides that, I know we gain surgical skills from the program, which is very highly coveted
Yeah.
by vet students. And I know students, we get to conduct diagnostic tests, right? Like leukemia and FIV tests on cats and things like that.
Yeah, so there's several different ways students are involved in the program, and the most obvious is what you mentioned, the surgical skills. And so, we have a 2-week elective that you'll get to take probably your senior year if you want to. And the way that works is that we will do surgery with you or your classmates the first day that you're on that rotation. We'll be standing across the surgery table, handing you instruments and telling you every step of the way and explaining what you need to do. But then after that, for the next part of the 2 weeks, we'll be around for questions or complications, and we can certainly scrub in if you need any help. But we expect you or your classmates to be the solo surgeon for that. And so that is a big thing that you gain, because it's so much fun to watch y'all go from, the first day or two, you're scared and you want us right there, and when you're asking questions about everything, and then by the end of the rotation, you can say, I think I dropped a pedicle on this, and I'll say, do you need me to come help you? And you're like, I got it. So it's really fun to watch y'all just blossom into these really good, confident surgeons. And you do through that. The thing maybe a lot of students don't realize, I think they come for the surgery experience, but then you can't do this rotation without being exposed to the shelter animals and the shelter workers. And so you really get a good sense of the things that the shelter employees deal with, and and you really get, I think, a good idea of how to help that once you're in a community that has an animal shelter. So I think that's a really good thing that you gain too. And then you're right, there's another branch of the program that takes students into the shelters to do physical exams, lots of diagnostic tests. And those are the things that if you're going to be in private practice, you really need to be good at. You're going to do a lot of physical exams. Your entire patient relationship is based on the physical exams and what you see. So that's a really important thing to feel comfortable with. And you get lots and lots of normal physical exams, and the more normal things you see, the easier it is for you to pick up when there's something that's abnormal. And you'll get to run a lot of basic diagnostic tests that you would do every day in a private practice somewhere. So that's all good stuff to get out of this.
Very valuable skills and very coveted, like I said, time in the surgery suites, and just I feel like a lot of experience can come from the program. But what advice would you give to prospective students hoping to join Mississippi State College of Vet Med family in the future? Do you have any advice or tips?
I think that you really need to know a little bit about what the vet med industry is about. So get out and get a well-rounded practice, volunteer for practices and shadow doctors, and have jobs and practices when you can. And then I think that once you're here, the plug, I guess, for Mississippi State is that my experience as a student and then now as a faculty member is that the faculty really, really enjoy y'all. We enjoy the students. You kind of make our job what it is, and you make it fun to come to work every day. And so my plug would be, don't be afraid to reach out to the faculty here, even when you're going through the process of applying to that school, and especially once you're accepted and once you're here, your family, and we're all here to take care of you and get you through this process. And we're here because we love that. And so don't be afraid to approach faculty anytime you need it, and just enjoy the family that you've gotten to be a part of.
Yeah, it can be a really overwhelming process just to even apply to vet school. I was always told, what is it? If your dreams don't scare you, then they're not big enough or something.
That's probably right, yes.
So,
but there's plenty of people here to help with that, help get you through.
Oh, yeah. Everyone was very helpful to me. Everyone is ready to ask questions or answer my questions, jump in whenever I needed it. But this program, this shelter medicine program, it's a beautiful and innovative program, I think. I can't wait till my turn comes. I'm so excited. But I think we're running low on time. So I just want to, thank you, Dr. Woodruff, so much for taking the time to chat with us today. I know you're very busy.
You're a student, so you're equally as busy. So.
I hope this has been enlightening for everyone watching. So thank you guys and good luck.